These are my 5 audience members. Imagine waking up one morning with a fever, your body aching, your vision blurry, and your breathing heavy. You know you're too sick to work, but you also know that missing even one shift means your paycheck will be short. And for millions of workers in this country, a short paycheck means something very real. Falling behind on rent, skipping a bill, or not having enough for groceries. No one should ever have to choose between their health and their survival. Yet, this is the impossible decision 25 million U.S. workers face every single day. This is why access to paid sick leave isn't just a workplace benefit, it is a matter of dignity, fairness, and basic human protection. According to the National Partnership for Women and Families, 1/5 of private sectors workers in the U.S. have zero paid sick days, and 25 million workers lack this basic protection. Low-income workers, those who already struggle to make ends meet, are the least likely to receive paid sick leave. 6 in 10 of the lowest income workers have no paid sick time at all. These are people working in daycare centers, nursing homes, restaurants, grocery stores, warehouses, and hospitals. They take care of us, yet our system doesn't protect them. But this issue is not just national, it is personal. For nearly 3 years, I have worked at Frederick Hospital, and during that time, I have been called into the office twice because of attendance. Not because I didn't care about my job, not because I was irresponsible every time. It was because I was sick or because my children were sick. As hospital workers, we only get 5 occurrences a year for call-ins. That's supposed to cover every illness, every emergency, every virus or families might catch. It's nowhere near enough. Every day I work around elderly patients who are constantly battling norovirus, COVID, or flu. I witness coworkers come in to work sick because they can't afford to lose another occurrence point. They cough, they sneeze, and touch every computer and door because they literally have no choice. The system pushes sick people into the workplace, even in a hospital where vulnerable patients rely on us to keep them safe. My situation became so severe that I am now at risk of losing my job simply because I used all my points. I have actually earned more points over time, but management never informed me before I reached my limit. They allowed me to reach 11 occurrences, more than double the allowed amount, before they gave me a warning, even though they should have warned me much earlier while all this was happening. I was also doing what any mother would do. I have 2 little girls who go to school and get sick, and they need their mom at home to care for them. And when they get sick, I often get sick too. That's life. But the intended system doesn't care about families. It doesn't care about children. It doesn't care about the emotional reality of workers. It's only care about numbers. The American Medical Association emphasizes that workers without paid sick days are more likely to work while sick, delay medical care, and spread illness to others. When workers show up sick because they fear losing pay or other jobs, it, it isn't just risky for them. It puts patients, coworkers, and communities at risk. There are also deep inequalities. Hispanic and Black workers are often denied paid sick leave. They are more likely to work jobs without protections, making them more likely to work while ill or send sick children to school. These compound health inequalities and emotional stress. Federal law does little to help. The U.S. Department of Labor explains that there is no federal requirement for paid sick leave. The only national protection, FMLA, allows unpaid time off for serious medical or family issues, but unpaid leave still leaves families financially vulnerable. These highlights the need for stronger federal mandate paid sick leave. Paid sick leave is not just about preventing illness, it's about emotional well-being. It's about reducing fear and offering relief. Everyone knows what it feels like to be sick. Imagine feeling that while knowing missing one day could derail your entire life or cost you your job. The solution is simple. Hospitals and workplace must provide paid sick days without penalties or point systems. Workers deserve to feel supported, valued, and safe, not treated as disposable. Policies must protect workers regardless of income, job type, or race. Paid sick leaves is a promise that no one will be punished for getting sick, that families won't suffer because of a flu, and that our society values people over profit. When we build systems that protect the emotional and physical well being of workers, we create a healthy, stronger, and more compassionate society. In the end, the truth is simple: people deserve care, people deserve respect, and people deserve the chance to heal without fear.